Hello and welcome to the Smart Connections podcast and the Talk the Path podcast. My name is Anna Sanderlin. I am a warm-line facilitator for the University of Memphis Smart Center. The University of Memphis School of Social Work Smart Research, Training, and Treatment Center aims to provide evidence-based interventions for school-based mental health programming, increase access for school-based behavioral health programming in underserved areas, offer training on best practices in telebehavioral health, develop opportunities to research the use of technology in practice, and provide direct services to the state's most vulnerable populations. You can call the Smart Center at 901-678-1636. The University of Memphis Smart Center, in conjunction with the University of Tennessee, Knoxville, and the Tennessee Department of Mental Health and Substance Abuse Services, would like to present the Pathways to Behavioral Health Careers Project. The goals of the Pathways Project are to provide education and information on the various career opportunities in the field of behavioral health through presentations, increase interest in students in the field of behavioral health, provide opportunities for guidance with information regarding college, university programming that result in degrees for professions in the field of behavioral health, connect students with students in behavioral health programs and professionals in the field for further research. This podcast will feature students and professionals in the field to give a clear picture of the daily duties of these roles and how they help support their communities.
My name is Kristel Scoresby. I'm an assistant professor in the College of Social Work in the University of Kentucky. I actually got my PhD at the University of Tennessee, Knoxville in 2023, and have been a clinical social worker for over 20 years.
Wow. Okay. That's awesome.
That's impressive.
So, Dr. Scoresby, I guess first off, can you please explain what the deaf and hard of hearing community is for listeners that may not already know about it?
You bet. So the hearing loss and deafness is considered a spectrum. So people might have mild hearing loss, or they might have complete and total deafness where they hear nothing. And there's all different levels according to this whole spectrum. But what's really interesting about the deaf and hard of hearing community is that hearing level doesn't necessarily define identity. So maybe people with severe hearing loss still would say, I have hearing loss, or I'm hearing impaired, or I struggle to hear. Or they might say that they're deaf. They might say that they're lowercase d deaf. They might say that they're uppercase D deaf. You might have folks who have mild hearing loss who say, I am deaf. And so people identify in different ways. But the overall umbrella is that it's folks who have some type of hearing impairment. Their hearing is not the same as a person that has full hearing. And so they're impacted in their relationships, in their communications, in their jobs, in their schooling, in all the different ways in which we have to listen. And that requires communication. It's going to be impacted. So folks who say that they have a hearing loss often are not folks who use sign language. Folks who claim that they are deaf or deaf disabled usually use sign language and are involved in deaf culture and deaf community.
I think that's great information, and that's definitely a good place to start because I know that it is kind of a broader term. So it's nice to be able to break that down and realize that truly, like everything else, it's a spectrum.
And could you please tell us about your journey to the field of social work and how you ended up in the deaf and hard of hearing community in social work?
Sure. So my first major in my undergrad was actually elementary education. And due to my own hearing loss, I was struggling to hear my classmates when I was having to go and present in some of the courses that I was taking. And the more I realized that, teaching in elementary classrooms is a bunch of little kids with a bunch of voices. And usually elementary classrooms have terrible sound acoustics. So sound is bouncing everywhere. And I thought, you know what? I actually don't think I'll be able to hear if I continue to teach. So, or if I continue to pursue this teaching pathway. So I decided I better look into other fields and see if there's something that would be a better fit. That's something that I feel like I could do. And then I found social work, and I had never considered it before. But when I took that very first intro to social work class, it was like this instant awareness of my soul that this is what I should be doing, and that um, I could have a little bit more control over the environment, the listening environment, than I could in an elementary classroom. So I could work with one-on-one with people in a small office, for example, or small groups in a room that had good acoustics. And so there was a little bit more, there were more options, I feel like. So, but I am a first generation college student, and I had not even considered at the time that there was a master's thing or what that even meant, right? And so in my undergrad program, and when I was getting my undergrad in social work, I was encouraged to pursue my master's. And, I thought, okay, I'll pursue it just for funsies, but I don't know that I need it or what I would do with it, right? And I got into the master's program and then just decided to pursue it. And then I learned in the master's program that I was being trained as a mental health clinician, as a therapist. And I didn't even go into the master's program knowing that that's what I was going to be doing. I was just like, I want to help people. So that's kind of what got me into social work and into the mental health field.
We kind of have like similar stories as far as how we got in the social work. So I
Really?
kind of think of it as like, I don't know if you watch Tinkerbell, but it's kind of like that for me, where I've tried different places. Like I've tried coding, I've tried other majors, and nothing felt right until I hit that introduction to social work class. And just like you, 2 semesters ago, I was undergraduate level, and the students who were in the master level inspired me to go to get my master's. So I'm hoping I have that same inspiration you had to to keep going.
That's great. And MSW it's such a wonderful degree because it just opens so many doors.
It
Oh,
does.
absolutely. Absolutely. So, Dr. Scoresby, how does your role of being a social worker fit in with the deaf and hard of hearing community?
Yes. So over time, so I've been a clinician for a long time, and I definitely had clients that had hearing loss. I didn't specialize in this area, but because 20% of Americans have hearing loss, so it's highly likely that all behavioral health professionals will come across people with hearing loss. But what's interesting is a lot of people with hearing loss don't disclose that they have hearing loss. They try to keep it hidden because of the stigma and all of these things associated with it. So I worked with people with hearing loss over time, but it wasn't until I went back to school to get a PhD. And I was pursuing research in different mental health areas, but then the pandemic hit, and I looked around, and I've had hearing loss my whole life, so I've been very involved in the deaf and hard of hearing community on a personal level. And my children have my hearing loss, and so we're involved in that way as well. And as I was looking around at some of the support groups I normally participate in, I saw this all of a sudden this high rise of suicide ideation that's showing up, that's bleeding through in these support groups when that wasn't there before. And when I started looking around and seeing what was going on, um, that what folks were saying in these support groups was that they were so stressed, not because of the illness, which was so interesting. They weren't scared of getting COVID, because they couldn't even think about being afraid of the actual disease, because just trying to communicate when everybody was wearing a mask, and social distancing, right? So it's a common accommodation. If you can't hear somebody, you lean in. But during the
Right.
pandemic, if you leaned in, you want to know what happened? Like, right? People jump back and they're like,
Right.
"Don't get near me."
Mhm.
And so a lot of people with hearing loss were so stressed out from their inability to communicate and to see people's faces and read their lips and see all of the things that we need access to people's faces to be able to completely understand what's going on. And
Mhm.
those faces were blocked, and facial expressions and the lips and everything was blocked, and masking interrupts the speech signal. And so even if you got close to somebody, their speech wasn't clear because masking
The
interrupts the clarity
mask.
of that
Oh,
speech. And so that that interaction of masking was so stressful for folks that you saw suicide ideation increase. And so, I was a PhD student at the time, and I'm just like, who's studying this? Who's looking at this? Like, we need to document this. And I couldn't see that it was being done. So I created a side project, got some funding, and I'm like, let's study this, right? And the more I got into it, the more that I saw how much need there was for information and research and policy, and that for this community, for this population, for them to have become more well known to those of us in the mental health professional world, and what's happening with them. So the more I looked into it, the more I realized we didn't have enough information on that out there. So I needed to do more. And the more I did, the more I got into it, until now it's like a huge trajectory of research that I'm working at in and identifying, the behavioral health and psychosocial needs, the psychological symptoms, and all of the things associated with hearing loss for folks, in being able to navigate the communication challenges they have on a daily basis.
Absolutely. And as devastating as the COVID-19 pandemic was worldwide, it is extremely exciting to get to see the programs that have arisen because of all the problems. I know we here at the Smart Center, this was a program that started in 2020 with our founder, Dr. Susan Elswick, who realized that we needed more telebehavioral mental health services because we didn't have access to our clients anymore. And doing these podcasts over the last couple of weeks, I have gotten to see so many programs that started during this extremely stressful time that are using the destigmatization of mental health to help people in the community. And it is just wonderful getting to see all these programs that are starting and that are still here, that are still working. So it's great what you guys are doing.
Yeah, that's a good point.
I just kind of want to thank you for bringing awareness to like the suicide rates and everything. I never thought about it. I never, that this is something I've never heard of. It didn't, I don't feel like it had much spotlight, because like this is my first time hearing it. And I think it's important to spread that awareness, but also spreading awareness to like resources for people who can hear, so we can better understand how to communicate with people who are hard of hearing. Actually, the Smart Center had worked with the hearing department here at the University of Memphis like 3 semesters ago. And it was my first time being around the community of people who have hearing problems. And I did research on how to communicate before going to meet with these people, and it was a lot of things that I just never considered. So I think getting that information out is very important. Like things like that you'll never think of as a person who has the privilege of being able to hear, such as not standing in front of bright lights so that they could see you. I think that's really important. And if I could ask you, what advice would you have for social workers looking to work with this specific community?
Yes, that's a great question, because it's not a population we talk about very often in the field of social work or in general. But yet there's such a huge need. There's such a huge need. So one of the things that I'm doing in my research is trying to integrate hearing healthcare and social work. And so bringing social work interns into hearing healthcare settings, for example, so that people with hearing loss can have exposure to social workers, because social work is so important, right? We do so much as social workers. There's so many things that we address. There's our assessment, the needs evaluations we do, the policies we look at, the mental health counseling if we go the clinical route. And so what I would love for incoming social workers is to realize that you have a person you're working with that has hearing loss. And traditionally, social work and other mental health has turned away people with hearing loss. And we say, we can't help you. We don't sign. So we make this assumption that if you have a hearing loss or if you identify as deaf, that you only sign, and we say, oh, sorry, we can't help you. So the better question, the more appropriate question would be, what are your communication access needs? What is it that you need so that this session or this work that we're doing together is accessible? So I'm not making assumptions about what that person needs. I'm asking them, how can we work together so that you have communication access? And maybe more likely than not, they're not going to use sign language. If they do use sign language, then yes, we need to get interpreters. But what about the millions of people who have hearing loss who might not know sign language, but what they need is to have captions on the Zoom sessions they're in, right? Or that the speaker is not sitting, in front of a window where the light is blocking out their face. All kinds of different things that we can do. But if we just turn people away, how will they get support or access when it's a matter of awareness? If we as social workers increase our awareness and say, yes, let's work together. I might not have a lot of experience in working with people with hearing loss, but I'm open to learning, and please help me to understand it. Then that's going to get farther, right? Than just saying, oh, go find someone who signs, because that's just not helpful. Yeah.
Well, and in the social work profession, you kind of have to have this mentality of, if not me, then who else? Who else is going to do the things that I know that even if I don't know how to do it right now, I can pull my resources. We're going to make it work. We're going to work together, and we're going to find a thing that works best for you. So do you happen to have, or did you have a role model that you found once you entered into the social work field?
Oh, lots of folks. There's incredible social workers. I'll have to say that one of my role models currently right now is Michelle Niehaus. She works for the state of Kentucky in the behavioral health department, and her entire job is to connect the deaf and hard of hearing population to community mental health services. And she has worked tirelessly in the state of Kentucky to increase communication access plans and normalize them so that communication access plans are just part of a person's chart. Like, it's just part of what goes into a chart is how they communicate, as well as increasing interpreting services and increasing just all kinds of outreach opportunities. So she's definitely one of my heroes.
I want to ask you, did you experience any difficulty along your journey?
Oh, of course. Of course. I think being a person who has a disability myself, it's really interesting to interact with people who are trying to be helpful and trying to advocate for social justice and trying to break down systems for our clients, but yet our systems are ableist. And so the structures we have in place we built our structures for hearing people. We haven't considered the needs of a person who might not have full hearing. And so all the systems we have built, including our education systems, including our research systems, including our offices and our group rooms and our agencies, are all built for people who have full hearing. So I have had, different pathways that because my own communication access was limited, I could not continue in that area or in that job or in that field or in that thing. And so it was blocked. And some folks would try to help me work around it. And some folks didn't think I should continue to be a social worker, didn't think that I should continue to work in this field or provide mental health delivery services because, if you can't hear a client, how can you help them? So it's really frustrating, right? It's really frustrating to have the skills and to have the abilities and to have the training and the experience to be able to deliver services, but yet I'm in a system that prioritizes hearing people, right? So here's just a quick example. As social workers, we have to attend conferences to keep up our licenses. We need continuing education units. Well, continuing education units in conferences, we have to rely on a presenter, and that presenter can share a wonderful amount of information. But if I can't hear that amount of information because they haven't turned their captions on, their PowerPoint, right? Then how am I going to access that information the same way as a hearing person would? So that's just a simple example, but that's one of my challenges is trying to advocate for the needs of the deaf and hard of hearing, even though I continue to push back against a hearing system.
Absolutely. And I think it goes to show that even in the field of social work, there are still going to be people that you are going to meet that have biases, that have stigma. So bringing awareness to it is absolutely the first step. And I know we already talked that social work was not originally what you wanted to go into. I know you said you wanted to be a teacher, but I do want to ask, what is the biggest challenge that you have with your role today, and how are you going to overcome it?
Yeah, and what's funny is that I did end up full circle coming back into teaching, right? But I teach MSW students, not elementary school kids. So the biggest challenge in my role today is currently I'm trying to integrate audiology and social work, and it's a new area of social work. And so trying to prove the importance of it has been a little bit of a challenge, as well as the type of research we do in social work different than the type of research that's done in audiology. So I've also had a little bit of a struggle with, submitting research to the audiology world, which is very like quantitative, and it's very, measures based and numbers based. And a lot of social work we do, it's stories, it's narratives, it's qualitative. Right. And so trying to bridge these two worlds has been challenging. I am making progress, but it continues to be a challenge I'm working on.
And I wanted to ask you kind of, how do you continue to learn and stay on top of things in this role?
That's a great question. I feel like it's really easy to silo yourself, especially if you have a disability. It's easy to be excluded because you can't hear what's going on, so you can't jump into conversations, or you can't pick up on peripheral conversations. And so there's a lot of times you're lacking information. So you have to be really proactive at seeking information. So I rely on reading and visual cues a ton. So I'm reading all the time I'm reading. But I also spend a great deal of energy listening. So listening to the folks who I'm studying, like listening, and those I'm working with, listening to the various needs of people with hearing loss. So that's one of the ways I try to continue to learn and continue to grow and to understand what needs are, is by reading and listening.
Absolutely. Now, for you, what is the biggest area related to your role that you are still curious about, something that you still want to learn more about, or possibly even do some more research about?
Yes, tons of things. But one project I'm working on right now with our ear, nose, and throat department on campus and our audiology department on campus is to assess the psychological and social needs, the psychosocial needs of the patients here, and implement an intervention. So I'm very excited about this because in the integration I'm working on between our departments, between our worlds, is I want to increase the interventions that are available for people with hearing loss within the hearing healthcare system. So the World Health Organization recommends that we don't just refer out. Like, okay, you're my patient, you have hearing loss, but you're also really depressed, so go see somebody, right? That's a referral process. Instead of doing that we integrate care. So I'm really excited about increasing the interventions offered to folks with hearing loss within the hearing healthcare system.
Absolutely. And as somebody who has worked in, medical in the healthcare system, when you are referring clients out, only about 50% of them will actually continue with your referral. A lot of times they're like, well, this was the time that I had for me, and, I didn't really get any help. They're just telling me I have to go somewhere else. And at the end of the day, it kind of feels like you're on a wild goose chase, just trying to find somebody who can help you. So I think you adding those interventions into your treatment plan so that they can go ahead and get started right away is absolutely wonderful.
And what's interesting about that too is that when you call or someone that's been referred to you, you have to make a phone call, right? People with hearing loss don't want to make phone calls. They can't hear on the
Right.
phone very well. And so
Right.
they're not going to, if an audiologist says, okay, here's a good therapist, call them. Guess what? They're not going to call them. Yeah.
Right.
Wow, I guess I never really thought about that before. What would you say is the biggest surprise you've had in the last few months and why?
The biggest surprise in the last few months and why? You know, I, this one, this one always hits me whenever I'm asked this question is as far as I have come in my own awareness and acceptance of my own deafness, it continues to hit me by surprise when my own children come across obstacles for their hearing loss. And it's heartbreaking to me every time. And so one of my sons just had a recent drop in hearing, a significant drop in hearing. And that just really caught me by surprise because I can expect it, but the way it impacted him just hit me so hard.
Absolutely. And you're also having to choose between, am I the social worker in this position or am I a mom in this position? And those are two completely different identities. I mean, people are multifaceted. So it's hard to have to deal with that, knowing that you know the options to go from here, but also that's your baby, that's your kid. That's hard. That's a hard thing to deal with. So for the next one, what has been the biggest failure in the last year? And do you happen to know why it happened, or do you have any reasoning?
In the last year, what is my biggest failure? Interesting. Okay, so I will say, I mean, when you work in science, it's common to be rejected.
Right.
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 Like your proposals are rejected, your papers are you're rejected, your presentations, etc. But I still view those as opportunities for growth. Not as failures, but as opportunities for growth, right? To learn
Absolutely.
something from. But one of the things that maybe feels like a failure a little bit is that I'm sitting on a manuscript. I haven't even submitted it. I don't want to submit it because sometimes it can be tough to blend my personal experiences with hearing loss versus trying to get the information out there, right? And so this particular paper it's a qualitative study, and I used a methodology that also uses my voice in the scientific process. And I have not submitted it because I have not quite been willing to put myself out there in such a vulnerable way.
Right.
But that feels like a failure. I'm just sitting on this paper that should be like out there, right?
No, absolutely. And I think that just highlights that social workers are humans too.
Right. And it will get out there at some point when I'm ready to be super vulnerable.
Right. Hey, and that is on your own time.
I want to ask you if you had an unlimited budget for your role, what would you spend it on and why?
Love that question. Love that question. It would be on communication access, hands down. I would completely change the way that we communicated on college campuses, in community agencies, and social work practices. I would automatically build in design for people with disabilities so that they could walk into these buildings, onto these campuses, into these practices, and just the design itself does not automatically exclude them. So I would spend money on having live captioning, for example, everything, everywhere. So that if I'm in person with a therapist or a mental health professional or a caseworker, that everything they're saying, like I have an iPad in front of me and it's live captioned, right? So I can see it, or it's big print so that those with vision issues can easily access it. I would put in certain colors so that, in fonts so that those who are colorblind can see the intake paperwork well, right? For those who have, autism spectrum disorders, I would break up the 50-minute session and not, have just like this uncomfortable sitting where we just sit someone down for 50 minutes, we talk. Or with children with ADHD, right? I would just build agencies and communities and education with just this universal design is what it's called, in which we build it intentionally with all different types of bodies versus a certain type of body that we just assume is the only type of body that's going to come into this building.
Absolutely. And I think that also just goes to show that if we had the money to do everything, we would be able to. But unfortunately, we don't. So we have to spend our time. We have to go outsourcing. We have to do outreaching. We have to meet with people and, get that word out there. So I think, you were doing a fantastic job with educating the people around you on the deaf and hearing loss community, as well as showing how we as social workers can do better, even in our own systems, even though we think that at times, we're at the highest level of, we're understanding, we're empathetic, but there's always something else that we can do to help our clients be more comfortable with the process.
Very true.
And I kind of wanted to ask, what are some things that people that are able to hear can do to better support people who have hearing problems? Like, what are some things that we could do to become more compassionate and more considerate of?
Yeah, I love that question. This paper I haven't submitted yet. It's a collection of people's responses during the pandemic when masking happened. And even though I didn't necessarily ask this question, I said, is there any additional information you want to share in these interviews? And so many of them said, yes, I have advice for the hearing people. And so I've actually compiled a list of their responses of what they want the hearing people to know. And they want hearing people to know we're trying. We spend 1,000% of our effort trying to hear you and trying to communicate. We are trying. And so if you say something and we can't hear, and we say, what? For you to say, never mind, it is so damaging and destructive to what we're trying to accomplish. So we want hearing people to understand communication is also on you. It's not just on me. So instead of saying, never mind, changing the way that you said it, for example, or pulling the person aside so that the quiet corner to talk with them, lowering the mask, if you're comfortable, if you're in a medical situation or pandemic situation, having the captioning app on your phone, they're free. Having a captioning app on your phone and you opening up your captioning app as a hearing person and being like, oh, this is what I said, right? That just the people with hearing loss want people who don't have hearing loss to understand that we can't do it alone. We can't communicate and do all the hearing and try to understand everything that's going on alone. We also need hearing folks for you to take the responsibility to communicate with us in effective ways.
Absolutely. And just before we go, I'm going to throw one last question out to you. Do you have any advice for any maybe future social workers that want to go into the field of social work and work with the deaf and hearing community?
We need you. we need people who are aware of the deaf and hard of hearing community and who have been trained in the issues that impact us. We need people to advocate and change policies and change systems so that we can, access communication the same way a person who is hearing can, or maybe not the same way, but an equitable way, right? As a similar way that would help increase equity. So we want any social workers who are open to working in this area to learn more and to explore the option to do practicums in audiology clinics and with speech language pathologists and with the deaf community and, with agencies that serve the deaf community throughout the state. So one, you're needed, and two, please learn, please look for opportunities to increase your own awareness and understanding so that you will not be a barrier in providing services for people with hearing loss, but that you'll help facilitate communication.
Absolutely. Well, I think that is great advice. So, anybody who might be out there listening, we need you. Come on, come join. We're always happy to have you. But Dr. Scoresby, thank you so much for taking the time to do this podcast with us. We were extremely excited to facilitate this with you today. And I know I personally am walking away with more knowledge than I came into it with.
Absolutely. I thank you for just the awareness to many things that I didn't take into consideration before this podcast. And I thank you for sharing it with other people as well so they could be educated. And you've definitely been more relatable than not turning your paper in and sitting on it. I think that's so human of you, Dr. Scoresby.
Thank you for the opportunity to share with both of you, and I appreciate your questions and your good listening skills. Thank you.
Absolutely. I hope you have a great rest of your day.
Yes, ma'am. Y'all have a good one.
Thank you. Take care.
Thank you so much for tuning in to listen to our podcast, brought to you by the Smart Connections podcast from the Smart Center at the University of Memphis, as well as the Pathways to Behavioral Health Careers Project. If you or anyone you know needs any information from the Smart Center, please contact us at 901-678-1636 or email us at smartcenter@memphis.edu. You can also learn more about us at our website, memphis.edu/smartcenter.